Live to the Prime Minister now.
Just make some comments on the Queensland floods. Sincere condolences for the family and friends of a woman who was found outside Ingham, 82 years of age. This is the second loss of life that we've seen in the Queensland floods. The Australian government continues to provide every support possible. Jenny McAllister remains on the ground there, working closely with the Premier, David Crisafulli. I'm in regular contact with David Crisafulli and will be personally engaging there as well. To this afternoon's announcement, which is a cracker that I'm very pleased with. My government, as you know, is very much committed to strengthening Medicare as part of building Australia's future. We understand that building Australia's future is more than just bricks and mortar. It's about the health services, the education that Australians need, and at a time where we've just had votes and have adopted the free TAFE legislation through the House of Representatives opposed by the coalition, budgets and government decisions are about priorities. Our priority is strengthening Medicare, not ensuring that every taxpayer pays for some to get a free lunch or a karaoke night or a weekend away at the cost of low and middle income earners. Australians rely upon Medicare as the centre of our health care. And today I can announce that we're delivering an additional $1.7 billion to properly fund public hospitals and health services next year. This funding will be delivered to states and territories to help cut waiting lists, to reduce waiting times in emergency rooms and to manage ramping. This matters to people, and this decision today will help save lives and lead to better outcomes for our nation's hospitals. This builds on what we're doing to strengthen Medicare, whether it be this additional support for our hospital system or, of course, our support for primary health care, our tripling of the bulk billing incentive, making medicines cheaper, the delivery of 87 urgent care clinics, providing the health care that people need when they need it in 87 different locations around Australia, more than 1 million Australians, 1/3 of whom are under the age of 15, have received the help that they need, and all they've needed is their Medicare card, not their credit card. We know that there's more to do, but we know that this is absolutely central. Labor created Medicare and will protect it and will strengthen it. Under this new agreement, the Commonwealth contribution to state-run hospitals will increase by 12% to a record almost $34 billion in 2025-2026. To give you some idea of what that means, in the Northern Territory gets the largest increase, a 30% increase, as a result of the fact that they need this investment. Right across every state and territory, this means a double-digit increase in Commonwealth funding for their public hospitals. This is absolutely central. Healthcare was the first issue that I engaged with as a very young man. It's what brought me into politics. Nothing's more important than strengthening Medicare, helping to deliver the healthcare Australians need, and I'm very proud of today's announcement.